Hi, everybody. This is Dr. Doreste with the Cranial Release Technique, back with another video. Today, we have a very special guest, Dr. Chris Akey from the natural state of Arkansas. Correct, Chris? You call it the natural state.
It is a natural state. Yes, sir.
Natural state. That's it. I have not been to Arkansas, but it's on my list. I would like to go, especially the fall must be beautiful there.
It is.
So, you just wrote a beautiful testimonial the other day about when we first met, and I think you said that was about 2006. Could that be right?
Yes, sir. 2006.
2006. And I want to say it was probably at a Master Circle convention.
Master Circle in Dallas, Texas. Yes, sir.
Was it really? Okay.
Yeah.
And you are a chiropractor, and you went to Palmer in Iowa.
Went to Palmer. Yeah, graduated in 99.
Graduated in 99 and opened up shop right away in Arkansas?
No, I did about 3 years of associateships in 3 different locations, and then put my roots in Arkansas in 2002.
2002. And when did you go to Brazil to practice?
That would have been 2001.
Got
No, 2000 to 2001.
2000. And just so everybody knows, where are you in Arkansas?
My practice is in Farmington, Arkansas, right outside of Fayetteville, the University of Arkansas.
And that's Northwest Arkansas.
Northwest Arkansas.
Great. And so I know based on when I first met you, your email is KidsDoc, right? It still is?
Kids Chiro Doc, yes.
Kids Chiro Doc. So obviously you've always been interested in applying chiropractic, especially with children. And that's a whole other conversation that most people, of course, don't even understand. Why would a child need chiropractic? But we'll maybe follow that up another time. But so you were very interested. You came, you got on the table to experience the cranial release, and you had some personal changes that you noticed right away. Because I was thinking today, how many times have you and I sat with a new patient, we write down what's troubling them, we start working on them, cranial release, and the next couple of visits they come in and said, hey, could what you do have anything to do with my blank that's feeling better, which they didn't even tell us about.
Right.
They think, most people think the average person walking in is that we take care of neck trouble and headaches and back pain. But when they come in and say, hey, I'm sleeping better, hey, my digestion's better, hey, my skin is better, my attitude about life is better. I mean, all these things start to change, obviously, because we're affecting the brain. So
right.
If you wouldn't mind just sharing when you came in and got on the table that first time. I mean, you came in, I don't remember if I worked on you or one of my buddies worked on you. And I don't remember if I asked you what was going on, but it was probably the things that most chiropractors complain, it's physical labor, let's face it. We're bending, we're pushing, we're pulling. And then we did the cranial release, and you had some fairly substantial changes. Would you mind sharing what those were?
No, not at all. So actually you did work on me.
Okay.
Dennis Perman said, go see my buddy Bill, and I stood in your light. So if Dennis said do that, I did that, right?
Right.
But earlier that year, I had some significant health issues. So I wasn't complaining about shoulder, neck, back, and all that stuff. My adrenal glands had actually fatigued out on me, and I didn't practice for several weeks. I was stuck at home, not practicing. So it kind of changed.
You had no energy?
Had no energy. I stayed in bed for 3 weeks.
Wow.
Luckily, I had an associate. We were seeing 150, 160 people a day at that time.
Right.
So that was pretty, devastating to me,
Yeah,
just
sure.
On many levels. So and I was kind of just coming out of this rebound of just wearing my body out. Right. And hurt, again, Dennis said, go see my buddy Bill. I'm like, let's do it. And when you gave me, the CRT, when I first sat up off the table, I wear glasses.
Right.
I could clearly see across the room, clearly, like not just in front of me, but like as far as I could see. I took this amazing deep breath that felt like I've never had a breath like that before. And I just felt peace and calm.
Wow.
And you had a line, you know, super long, because this was our big conference that year. But you were gracious to me. You gave me time. Soledad gave me time, and I immediately signed up to take the course for myself and my associate.
Right. I remember that like it was yesterday. It was 2006. Wow.
And yeah,
Incredible. And when you sat up after the CRT and you said you could see everything across, because it was a big meeting room, at that point you had put your glasses on or had not?
No, oh no, because you know, when you take glasses off, you put them off to the side, right?
Yes.
You want everything, just you don't want anything in the way or whatever. I do the same thing. No, I sat off from the table, and that's what first. It was just amazing. I was like,
Right.
wow, I can see. And I think I remember you saying, well, of course you can see, but you didn't know. I had already put my glasses to the side. You didn't do that. You were just, I think Soledad took my glasses.
Right.
And so you didn't realize that I was wearing
Right.
corrective.
Yeah. Yeah. Wow.
But what's amazing as well is my prescription at that time was -3.5. Well, my prescription right now, as we speak today, is -1.5.
So for
it
those
has
of you, including myself, that don't wear glasses and don't know much, tell me what that means. -3.5 back then means, and now you're -1, so you've improved.
Oh yeah. I mean, so yeah, -3.5 to -1.5, right? So the bigger the number, the poorer your vision is, right? So 20/20 would be 0,
Right.
and then you go, you know.
Wow.
Yeah. And it has stayed there. It has stayed there. And the eye doctor, I mean, as soon as every time I go, every year I go, he's like, all right, let's see what, you know, Cranial Release has, you know, kept your eyes the same. He's like, and I'm 48, and he's like, I don't see this in my practice. So
Right. Yeah.
Anyway.
And you know, I used to talk about if you could build an alliance with an eye doctor, either an ophthalmologist or optician, because remember when they take they take the eyeglasses out of the factory made box or wherever they come from, and they put them on somebody's head, they don't fit right, so they got to twist them and contort them because the cranium is distorted.
Yep.
So if they could understand that concept, that how, if the cranium is distorted, how could you expect the eyes to function optimally? And certainly one eye is going to be worse than the other. I mean, that it does kind of make sense, but it's like so simple that people can't get it sometimes, as you and I know. I mean, this is, you know, half the battle is just educating people. That's
right.
That's what it is. I mean, you probably find the same thing. If you once a patient is educated in this and they understand that even though they're only spending a minute or two with us as far as the cranial release goes, this is something that they can't do on their own. They can't go anywhere else. They can't take a vitamin that does this. They can't do yoga that does this. They can't do martial arts that do this. They need to see someone that knows how to do cranial release. That then is a very, you know, those are the people that I love to have. They're the ones that refer people. They bring in their family, their friends, and that's the practice that you want. Is kind of that's what I always wanted, was kind of a low stress. Let them come in. Let me educate them. You know, it's not about pain necessarily, although some people come in with pain. I understand that, and we've all had times in our life where we're in pain. We're looking for help. I get that completely, but the educated consumer is our best patient, and that's always been my motto. You know, so great.
Right.
So now that was 2006. So then you took the training, you went back, and you started bringing it into the practice in Arkansas.
Immediately. Yep.
Immediately. And I remember there were a few testimonials of some patients you sent me. One gentleman I remember with kind of, I don't know if it was blonde or grayish hair, and I forget what his story was. He might have been diabetic or something, but I know you were sending me some testimonials. So now 16, 17 years later, you're still using it in active practice.
Oh, yes.
For the people that are out there that are watching this, that are practitioners that do not do cranial release, that really don't know much about it, I mean, other than watching the videos and going to the website, what would you say to them if they're out there looking to add something, or even if they're not looking to add something to their practice? what would be the advantage in your mind of someone bringing cranial release into their practice at this point? Regardless of whether they're right out of school, maybe they're in practice 10, 15 years, maybe they're, you know, 40, 50 years, almost getting ready to say, I'm going to hang it up. But I still, and just before you answer, I just had a conversation with someone that said that, you know, it's great that you do, you're going to learn this and take it into your practice, but it's something you're going to take with you wherever you go. Even when you're done with practice, you're going to work on your children, your grandchildren, your friends, your family, whether in a practice setting or just as friends, you know, for the rest of your life. So for the practitioners out there that's saying, well, maybe I should learn this thing, what would you say, you know, to them if they were listening in on this talk right now?
Well, so my initial thought, my simplistic answer, and then we can go deeper, is if you want to affect the nerve system the greatest, it lies in the cranium, right? 80% of the nerve system is in the cranium. So you have to take that stress off the nerve system, and to effectively do that, it's with CRT. You will then make massive change to the rest of the body. So that's the simplistic answer of why you should do it, because there's no technique. And in our profession, and again, I know we're reaching other professions as well, right? So, but in our profession, there's no technique that taps into 80% of the nerve system.
That's it. No, I agree. And then if we go a little deeper, and then by addressing that 80%, as I got my buddy here, by addressing the 80% here, we then address, because of our friend the occipital bone here, we address the alignment of the spine, and then we also address the covering of the brain that's called the dura mater, for those people that are out there that aren't familiar with that term. And again, especially since you deal with a lot of kids, you know, I think I may have mentioned this to you in one of the classes, but, and again, I don't know how well this shows up in the, on the screen here, but this is a plastic model of a fetal skull that I bought from an anatomical company. And when you look at it, and it may be hard for people to see, it's completely distorted.
It is, right.
All right, so there's one eye that's smaller than the other, one eye that's lower than the other. The whole cranium is rotated. And when I saw this, I took it out of the box and I said, wow. And then I called them and I said, how did you create this plastic model? And they said, well, the truth of the matter is, unfortunately, it was molded from the skull of a stillborn. So this is how most children are born. And especially as you and I know from looking at kids all the time, you're going to see distortion from day one virtually. And so the whole reason why you and I do this is that if people understood, in theory, we would be there in the delivery room as soon as the baby's born, wipe the baby off, give him to me or you, do the cranial release, give him to mommy, let him have a drink, and you just changed you just changed their whole life from that 1 minute technique that you just did. And I was thinking about this before we got on the call. I can remember working on a child that was, I think the youngest child that I personally worked on was either 2 or 3 days old. It was a patient of mine. She brought him to me right after delivery, as soon as she came out of the hospital. And I remember doing the technique. And that was the youngest that I ever worked on. And when I did the technique, it was the most incredible sensation that I ever experienced. It was as if the baby's head kind of opened into my hand. It was as if you took a sponge and you squeeze it and you let it go, the way the sponge springs back out. That's what happened. I did the one side, I felt it open into my hand. I did the other side, I felt it open into that hand. I said, wow. You know, and the earliest before then was a week. Now, I had never experienced that. I've never experienced it since. But imagine if, you know, we always in chiropractic say, gee, we should have a chiropractor in the delivery room as soon as the baby's born to check them for vertebral subluxation, which makes a lot of sense.
Mhm.
But I would say maybe one step better, or at least on par, would be get someone in that does cranial release so we can work on the baby from day one. Why would we want to wait until they're 20 or 30 with migraines and acne and health issues? Why would we want to wait? We want to get people in now. So if you're out there watching this, and if you're in anywhere, so Chris, like 100-mile radius of you would be, what's your other states in your area where you are? I forget my geography there.
That's okay. Oklahoma, Kansas, Missouri.
Oklahoma, Kansas. If you're anywhere by Northwest Arkansas, you really should contact Chris and come in for yourself, your children, your family, people at the church, whatever, because everyone's walking around with these bones twisted. And all you have to do is go look in the mirror. So when you finish watching this little interview, get up, go in the mirror, look at your own eyes. You're going to see one eye smaller. You're going to see one eye lower. You're going to see one cheek lower. You're going to see your ears rotate. And if you can't see it on yourself, look at your wife, look at your husband, look at your kids, and you're going to see distortion. And unless you bring them to someone that does cranial release, and if you're in Chris's area, go to Chris, obviously, or go to the website at cranialrelease.com. But the point is, and the reason why we do this is we want people to function optimally. I mean, it's such a simple concept, and people spend so much money on all the other things, which are great. Take your vitamins, go to yoga, you know, get the $10,000 mattress, do all those things. That's great if you can afford that. But go and get on the table and receive cranial release if that's possible. So find somebody in your area. So beautiful. Anything else, Chris, you want to touch on?
Well, if I can add to that of why, you know, a little bit more of why is, you know, if the child is fortunate enough to have a vaginal birth, you know, I go a little bit bold, and I say to the mom, I said, it's not a garage door opener. That cranium has to push and push and push and push, and that's where that distortion can happen right away. Or you know, grabbing the head with forceps, grabbing the head with hands, twisting and turning. That's trauma to that child, to that cranium. And then of course C-section would be even worse, right? So,
and the vacuum extractor as well.
And vacuum, yes. Oh yeah.
So just so people understand what we're talking about, so when the baby is born, a normal vaginal delivery, that head should pass through mom's birth canal, and that compression. Now I just read this too, Chris, and I don't know, I read it in one source, and maybe you've heard of it, maybe you haven't. I've heard that humans are the only mammals whose head, the baby's head, is larger than the birth canal. And I don't know that that's a fact, but I read that in a scientific journal, and I'm looking up to back that up. But if that's true, and the baby's head is coming through the birth canal, there's tremendous amount of compression, then the head exits, and then the head should sort of blow open. And that's why I use my other friend here. And again, I don't know if people can see this too well through the screen, but we have the birth canal, compression. The head passes through. The head should then blow open, and that kickstarts this cranial rhythm that should stay with us and does stay with us for the rest of our life. The problem is, though, when the cranium is distorted, that rhythm, that cranial pump is restricted, and that then affects everything in the body. So that's it in a nutshell. I mean, I don't know what else to say. I mean, you can go around the circle, but that's really what it is. So
that's it.
So that's it. So any type of, and that's why even, you know, great if you can bring the baby to Chris or bring the baby to me, but even better than that to me is bring mom in while she's pregnant.
Yeah. And
if you're a mom out there and you're pregnant, you could have someone, or you could do it yourself. You just stand up and put your fingers on the, let me do this. Put your fingers right on the edges of your pelvic bones here. You're probably going to see one bone is higher, one bone is lower, and that just tells me that the pelvis is distorted. And now that birth canal is going to be even more restricted. And so now that's another reason why you should come in before delivery. And even better than that would be mom and dad come in before conception. That even makes more sense. So that we optimize function in mom, optimize function in dad. And then when conception happens, we continue with cranial release and keep the system optimized, keep the function optimized, keep the body balanced. And that's it.
Yeah.
Anything
Well,
else?
and the other thing is, you know, we do this with our car, right? We do maintenance on everything else, right? We take care of everything else, but we neglect the number one thing, which is our body and our health, and we need to kind of change that thinking around.
That's true. Excellent point. Excellent point. So great. With that, again, what town in Arkansas are you?
Farmington, Arkansas.
Farmington, Arkansas. Great. Northwest Arkansas. Chris is on the website as well. Chris, thank you for your time. I really appreciate it.
Thank you. I look forward to seeing you in December.
In a few months.
Yes.
See you in December.
I'll be there. Looking forward to it.
Yes, me too. Me too. As a matter of fact, for those of you that are practitioners, Chris will be with us in December at the Mastery Review here in Fort Lauderdale. If you haven't registered for that, that's only open to existing practitioners. And if you're not a practitioner and you'd like to learn more about cranial release, you can just go to the website, hit the online training button and learn about that program. You'd have to go through that first before you come to the live training. And that's it. It's pretty simple. I call it the 1-2 punch. So that's it.
There you go.
Thank you, Chris. Appreciate your time.
Thank you.
Great afternoon and a great weekend.
You too. Bye-bye.
Thank you.